Hi, in this video we are going to see about case study on mammogram. As we all know that what is mammogram? Mammogram is a process or a scanning method which is used to identify the cancers in the breast, right? Uh, this video is going to tell about the case study on mammogram. What is mammogram? A mammogram is a specialized medical imaging that uses a low dose of X-ray to examine the breast for the early detection of cancers and other breast diseases. Okay, as I told you already, this mammogram, it is a type of X-ray machine, a low dosage of X-ray machine which is used to examine the early stage of it is used to examine the breast for the early detection of cancer and other breast diseases. Okay, it is used as both as a diagnostic and a screening tool, which is this mammogram is used to diagnose what kind of what kind of disease is that, and also for screening tool. It is also a screening tool. What kind of in what range the cancer is about and what range the disease is about. It is used to identify those things. Okay. Next, digital mammogram. What is digital mammogram? This is also called as full field digital mammography. Okay, digital mammogram is also known as full field digital mammography. Okay, in which the X-ray film is replaced by electronic that converts X-rays into mammographic pictures of the breast. Okay, in which the X-ray film is replaced by, we have in normal mammogram we will be having X-ray films, but in the digital mammogram, okay, will be replacing the X-ray films by the electronics that converts X-ray into mammographic pictures of the breast. These detectors converts the X-rays that passes through them into electronic signals that are sent to a computer. Okay, we have a detector in the mammogram machine which is used to detect the part which part we are going to scan, which will detect by passing X-rays and convert that into the electronic signals and send those data to a computer. Okay. The computer that converts these electronic signals into images that can be displayed on a monitor and also stored for a later use. Okay. Then after sending those data to the computer, the computers then converts these electronic signals into an image where we can see which part it has been affected, how the range, how it has been affected. We can see those by looking into the images which we gain from the computers. Okay, and we can be stored it. These images can be stored it for the later uses also. Next, you can see those pictures, mammogramic pictures. From the image we can see that it has since it is we can see it is slightly blurred, but the original image it will not be so. The images will be of very clear and very resolution will also be high. These are the mammogramic images where we get from the computer as an image. Okay. Next, breast tomosynthesis. What is breast tomosynthesis? In which X-rays of the breast are taken at different angles to generate thin cross section within two-dimensional mammogram. Okay, what is breast tomosynthesis? In the sense in which X-rays of a breast are taken in different angles. We cannot take only in one angle to measure to identify what the disease is that, right? So we are going to identify the disease by passing X-ray is in cross sectional, which can be viewed in a two-dimensional images. Okay, uh, in two-dimensional mammograms takes images only from the front and side. Okay, it is going to take the images only by front position and also by side position. Okay, this may create images with overlapping breast tissues. Okay, overlapping by having two-dimensional image, by measuring in front position and also in side position, we will be having a breast overlapping tissues will be overlapping in that. So the three-dimensional representation of a breast is similar to three-dimensional image created by standard CT technologies. So we are going for three-dimensional image, which is very similar to the 3D CT technology. CT image, as we all know, CT is computer tomography technology, which is similar to this mammography. 3D mammographic representation is similar to 3D computer tomography technology. Okay, tomosynthesis differs from CT technology, that is significantly fewer X-ray beams are projected through the breast. Whereas in CT we are going to pass a large number of X-rays, whereas in mammography we are going to pass only a small fewer amount of X-rays into it. Okay, breast tomosynthesis may also result in early detection of small breast cancers that can be hidden on a conventional mammogram. Okay, we can by using breast tomosynthesis, okay, we can identify the smaller breast cancer in early stages. In early stages itself, we can identify a smaller breast cancers. Okay, greater accuracy in pinpointing the sizes, shapes and location of the breast abnormalities. Okay, we will have a greater accuracy in pointing the size, shape and the location of the breast abnormalities. We can clearly identify what is present in the breast. Okay, fewer unnecessary biopsies or additional tests. We need not, after taking breast tomosynthesis, we need not go for any other breast test what we are going to undertake after that. That is not necessary. Okay, once the breast tomosynthesis is done, we can clearly get into an identification that what is happening, what has happened in the body. Detecting multiple breast tumors. It is used to detect multiple breast tumors. Since we have, if we have only one tumors, or we have many number of tumors, we can identify all those things in breast tomosynthesis. Okay, clear images of abnormalities. We can get a very clear images of those things. Okay. Next, what are the types of mammograms? Mammograms are used as one as a screening mammogram, another one is diagnostic mammogram. One is for, we have two types, one is for screening mammogram and another one is for diagnostic mammogram. Screening mammogram to detect early breast cancer in women experiencing no symptoms. As we all know that we get into a trouble or a issue after once any symptoms we suffer from in our body. After we are having symptoms, we will go for the doctors to identify what is happening. But in the screening mammography, it will detect breast cancer in women experiencing with no symptoms. Whether we don't have any symptoms, you can identify easily by using the screening mammogram. Whereas in diagnostic mammogram, breast disease in women experiences symptoms such as lump, pain, skin dimpling or nipple discharge. Okay, these by identifying these, if we having these symptoms, we can use the diagnostic mammogram to identify what has happened. Okay, whereas in screening mammogram, since we have no symptoms also, we can identify what is happening inside. Okay. Next, how are the screening and diagnostic mammogram differs? The same machines are used for both the types of mammograms. Okay, however, diagnostic mammograms takes longer to perform than screening mammograms, and the total dose of radiation is higher because more X-ray images are needed to obtain few of the breast from several angles. Whereas in diagnostic, we required many or a large number of X-ray images to identify what has happened in it. Okay, the technologies may magnify a suspicious area to produce a detailed picture that can help the doctor make an accurate diagnosis. Okay, this is about diagnostic mammogram. Next, how do you produce work during a mammogram? How does the procedure works during mammogram? The patient's breast is placed on the flat support plate and compressed with a parallel plate called a paddle. Okay, here the patient's breast is placed in the flat plate, and it is compressed with a parallel plate called paddle. An X-ray machine produces a small burst of an X-rays that passes through the breast to detect locations on the opposite side. Okay, the detector can either photographic film plate which captures the X-ray images on film, or a solid state detectors. It can be a X-ray film or a solid detector machine, okay, which transmits electronic signals to a computer to form a digital image. The image produced are called mammograms. You can see those images, how the images has been produced in the different angles how the images has been taken, have mentioned here. Thank you.